Okay, so here's my 6-week post-op video. I had my follow-up appointment with my doctor's assistant today, the physician's assistant, and so during this past 6 weeks since I've updated, no weight bearing, crutches only, been going to physical therapy twice a week, and limitations for that have been, of course, no weight bearing, no bending beyond 90 degrees, and even at 90 degrees has to be very limited. If I sit at 90 degrees, even now, it's painful after just 10 or 15 minutes. So I have to watch that. I haven't been able to bend beyond 90 degrees, and I had a couple of falls, one falling up the stairs onto my operated leg. So that was a bit painful trying to recover from that. So I feel like I've had a couple of setbacks, but overall making progress. And so when I went in to see the PA today, she said that I'm able to slowly come off my crutches, bear a little bit of weight for the next few days, and then maybe switch to one crutch in a week and then slowly come off of them. And then I can sit at 90 degrees, I can bend past 90 degrees as long as I'm really gentle and basically doing it, until it hurts and then backing off and not overdoing it. So that's kind of where I'm at. And physical therapy, I can now start having some resistance on the bike. Physical therapy, basically, as of right now, I do 5 to 8 minutes with no resistance. And now I'm able to do a little resistance, and I'm not able to do the elliptical or anything like that. So I have to wait until a little before my next appointment, which is in another 6 weeks before I can get on the elliptical. So she wants my physical therapist to start doing some activities that include some weight bearing, but also really stretching my leg up, bringing it up toward my chest, and moving it in some of those other positions or further range of motion that it hasn't gone yet. She did do some stretching and some testing to see where it hurts, and so now I'm pretty sore after my appointment. But overall, I feel hopeful that I'm starting to make some progress and that things will slowly get better. Um, After I left her office, I was pretty excited and tried bearing a little bit of weight, but it was really painful on my foot. Um, some of the things I haven't posted about is the status of my ankle and my foot. Immediately after waking up from surgery, I felt a lot of pain in my ankle. Just even moving my foot around like this was pretty painful in my ankle. And then if I touch my toes on anything, it's like this really weird, painful sensation. Even all along like my toe pad, it's all really painful. So stepping today down, not even bearing 25% of my weight, was painful on my foot. So I'm gonna have to be really careful with some of that. I'm probably not gonna start driving for at least a couple of days, and even then, I'll have someone with me and to make sure it's safe. The doctor did say she doesn't want me working for a little bit longer. I was supposed to take 4 weeks, then with the microfracture 6 weeks, and then just since my sitting at 90 degrees, even for just a few minutes, is painful, she wants me to take a little bit longer to go back to work. So my go back date is September 17th right now, and I'm pretty sure that I'll be able to make that. So that's really it. That's all my updates. I'm gonna just not push it too much, but I'm really anxious to get going. However, I don't want to set myself back. So I'm just gonna be cautious and just, bear some weight as tolerated. But still, my crutches are gonna be my best friend probably for the next week or two. And then, what was I gonna say? I don't remember. But I guess we'll just see how it goes. Um, I'll post another update probably in the next couple weeks just to talk about how it's going, and hopefully I'll be off crutches by then. And we'll just see. Talk to you later.